One of the most important social sector programs of the center, the Jal Jeevan Mission, promises to ensure every rural household gets access to piped drinking water by 2024. We have the Secretary of Jal Shakti, Vini Mahajan, here with us, who's going to tell us how such a program is being implemented across the country. Welcome, ma'am, and thank you very much for speaking to us.
Thank you for inviting me.
I start with a very basic question. When this ministry came up in 2019, there were many speculations as to how are you going to ensure pipe drinking water to every rural household, because water is a state subject. And the country itself is very diverse, with every state having its own set of water needs. What has been the progress on this mission so far?
Absolutely. Under the Constitution of India, water is a state subject. Different states have adopted different approaches, have had different priorities. And when the Honorable Prime Minister, in his Independence Day address in 2019, said that the country would move forward at speed and scale and assure drinking water to every rural household, different states of the country were at very different bases. There were states that had 1% coverage or less. There were states that had gone up to 99%. So there was also, of course, we know that huge agroclimatic difference in the situation. There were states with ample water. There were states that are water stressed. There were states which had ample water, but that water was contaminated. We know there's geogenic, arsenic, fluoride, etc. in large parts of the country. So the challenge, therefore, was to make sure that every house in every village, and remember, there are almost 6 lakh villages in the country that we're talking about. At the moment, the number of rural households is estimated at about 19.4 crores. And when we started on the 15th August 2019, there were 3.23 crore households in the country only that had reported access to piped water supply through a tap connection. So the task was humongous and involved large number of villages, large number of households, of course, across different kinds of situations. The good thing is that this program, the Jal Jeevan Mission, saw a huge combination of factors which resulted in amazing outcomes in a short period. Those factors started primarily from political will at the highest levels, but going down to states, going down to villages, actually. I think every village community leadership is totally in sync with this vision and mission. There was huge funding made available as per requirements. So remember that we're talking of the order of rupees 3.6 lakh crore, which was expected in 2019 to be what it would take, and which Government of India said that it would, be supporting, and the states and UTs, because it's a centrally sponsored program, have totally participated in through their own state shares as well. There was a need to engage with other stakeholders, but especially with communities. So all of that, the partnerships, the public support, the funding and the will, everything sort of came together. And this happy confluence of factors, I think, is what has resulted now. We are so proud that a coverage of less than 17% in 2019 is now a coverage of over 60%.
That's amazing.
And in this short span of time, over 8.5 crore rural households have received tap connections. Remember these figures, this is like giving all of the USA, the population of the entire USA, giving them tap water connections, or year on year covering an entire Japan. So that's the scale of the work that's been done. Also remember that it's not just giving a tap. The program says, the mission says that there will be water at a minimum quantity which is 55 liters per person every day.
Mm.
It will meet the quality norms, which is BIS 10,500. So there should be no chemical or bacteriological contamination. And it should be regular and sustained day after day, year after year. That's the scale of the work that's been done.
So, ma'am, 17% to 60% is quite massive, right? I wanted to ask you, you're a very hands on bureaucrat. I keep tracking you, like you go to Kashmir, you go to a lot of other states. Tell me, how important is the contribution of women, in getting piped water to every household? You're giving them a sense of ownership when you make them part of Pani Samitis. But actually, on ground, do you see families respecting women more? Or, do you see them getting a sense of an agency? What are the changes happening on ground?
I think it's a no-brainer that this, provision of tap water supply to homes has greatest impact on women's lives. We know that historically, traditionally, all over the country, it is the woman who has the responsibility of arranging water for drinking, cooking, and other household purposes, regardless of whether that water is available through a well in her own house, or she has to travel miles away with pots on her head and so on. But it is the woman's role, and young girls, have started at a very young age going with the women to do this. So, in recognition of that, and the fact that it is therefore the woman who is, in a sense, the interested party, but the mission sees women not just as recipients or beneficiaries of this program. They're actually leaders of this program, certainly on ground. So at the conceptual stage itself, it was insisted that every village must have a Pani Samiti or a village water and sanitation committee. At least half of the members should be women, and also adequate representation of the disempowered sections, so that at the stage of planning for the work, what would the source be, how many households need to be covered, and all of that, through the oversight of the implementation phase and eventually the O&M phase. Women through the VWSCs are to play a critical role in this. Then this the issue of water quality, right? I mean, there's no point giving water which is still contaminated. It could have been treated, but if it doesn't have proper chlorination, for example, and chlorination needs to be done regularly to the right standards and so on. If that doesn't happen, you could still have bacteriological contamination, and you could still have an outbreak of dysentery or cholera and so on. So there has to be also an empowerment qua quality of water, and therefore the concept of training women. So the mission has urged all states and UTs that at least 5 people, preferably women, should be trained in every village of the country to be able to use the field testing kits that the program provides across the country, and to be able to determine the quality. So the idea again is that they must understand, and it's such a pleasure now when you go on ground. There will be women there, and जब हम पानी समिति के members हैं, they would be trained in FTKs. You ask them, what is this? They know this is for arsenic, or this is for fluoride, or whatever, the iron or turbidity. And when you talk to them about, issues around water, they're totally charged. They know what it means. When you ask them, are you willing to pay user charges for this? It's an unequivocal yes. And one of the great things is that we have by now this huge network of women self-help groups in all rural areas. So that's something which is such a powerful institution for the water sector as well. Because we've seen anecdotally, again, wherever the states have given the women self-help groups this responsibility, they've been carrying forward the O&M brilliantly. So, they have no difficulty saying, hum har ghar se jaake, they, whatever the panchayat determines, 30 rupees per household per month or whatever, they collect that, they use that for making sure that there's a pump operator in place, the scheme works well, all of that. So women's role is central. I mean, if you look at it, there are some 18 crore women already
Hmm.
who've been, benefited by not having to
Right.
go out and fetch water, the impact it has on their security, on their dignity,
Hmm.
on the time that's saved.
Right.
They can be with their children while they study. The girls have more time to study. They can do economic activity. So all of that, and they talk about this and they tell you, and of course the impact on health, their own health, their family's health, and so on. So it is clearly something where women are hugely impacted, but also providing the leadership in making sure that these schemes work well and work well going forward into the future as well, we hope.
So, ma'am, the government has been generous when it comes to allocation for Jal Jeevan Mission. But like any other social sector scheme, underutilization has been a problem. I know it's a state subject, and looking at social, very local issues like looking at contractors, making sure that they are paid on time. These are extremely micro issues that the center may not really have too much of, control over. How are you managing that? How are you expecting states to work with you in a nice fashion, and how are you promoting them to utilize the budgets that have been allocated to them?
Um, I think our relationship with the states, and especially the agencies dealing with Jal Jeevan Mission, has been a very happy one where we are working together. They reach out to us for whenever they have a problem. For instance, when you are doing a large scheme, especially if you're bringing in water, maybe from a dam or a river through a multi-village scheme, you may be crossing a railway line, there would be national highway clearances, environment clearances. So when the states reached through to us and said that, sometimes delays in the clearances, delays their projects, we were able to quickly respond, put in place a portal where we encouraged all states, just let us know where you need some fast tracking. We worked with our sister ministries here, Ministry of Environment and Forest, National Highways, Railways, GAIL, all of them put in place, fast track mechanisms, nodal persons who could be reached out to, and so on, just to make sure that we all worked in sync together and we could get the clearances through as quickly as possible. Similarly, there were issues that the contractors faced with regard to pipes. At one point, there was this huge inflationary pressure because of global factors, and the pipes are a very important component of all water projects. So the pipes are sometimes GIDI pipes, or they may be HDP, PVC kind of plastic-based pipes. So we worked with the Ministry of Steel, with the Department of Chemicals and Petrochemicals, with the industry, talking to them about how the prices are going through, what government is doing, and building confidence and encouraging them that this is an opportunity when they must come forward and not look to maybe abnormal profits, because it is tempting when there's so much demand. So all of that, working with the states on making sure that there were no financial constraints. So if states were not getting money from their own finance department, they would kind of whisper in our ears, and then we would reach out and make sure that funds were released. Government of India, of course, has been very generous with its funding, but we must recognize that after all, offtake, the ability to spend is constrained by the fact that the departments working in the states on ground have never done so much work. So this is a quantum increase in the amount of work to be done in a very short time, and to be done to quality, because quality is something that we insist cannot be compromised. So there have been challenges around building the human resource and improving the uptake. But the good news again is that across all states and UTs, they've all been ramping up hugely. And our spending under this program, therefore, for both central and state monies put together, year after year, is seeing a doubling consistently. From 10,000 crore in the first year to 20,000 crores in the next year to 44,000 crores in the third year, and finally last year at 92,000 crores. So this is how the scale, is moving up, and we are very sanguine that the efforts that are being made consistently across the country are yielding results and will show even more as we go forward.
Right. So there is a difference in the scale and intent because successive governments have focused on bringing water close to habitations. But what changed after 2019? Like you said, it's to do with the scale. But now I see a dashboard. I see that you're also doing studies on ground. There's a lot of focus on assessment, right, and outcomes. So tell us what is the big picture? What is changing when it comes to Jal Jeevan Mission?
Yeah, so I think if you compare with other efforts, and there have been efforts through the years at trying to get clean drinking water to rural populations, some of the things, of course, are the technical parameters. So the ambition earlier was to reach at least 40 liters per capita per day. That is now a minimum of 55 liters per capita per day. Earlier, if we were satisfied with getting water into the habitation level, close to the homes, now we are not satisfied with anything less than in the home. In the home, also in the public institutions. So schools and Anganwadis, for example. By the way, I must stop here for a minute. Schools and Anganwadis are another huge success story under Jal Jeevan Mission. So there was a massive effort made in the year 2020 onwards to get schools to be covered. And from a coverage of 5% of government schools at that point in time, we've moved to 88%. From 2% of Anganwadis covered, we've moved to 84%. And that's meant, 11.5 crore school children in government schools have benefited with this clean water through taps. 6 crore children, little ones in Anganwadis, have received additionally. This is the addition since 2019 have got this. So there is this all-round effort to try and make sure that water reaches homes and institutions. There's also this huge thing about engaging with communities through the village water sanitation committees, making sure O&M happens, encouraging states to put in place O&M policies, to levy appropriate user charges, allow collection, use, retention at the local level. So community empowerment. The whole partnership with the other stakeholders. So there's so many development partners, or academics. We have 5 professor chairs in IITs, IIMs, etc. We have Indian and foreign development partners working with us. And we put all this information in the public domain. So there's a dashboard which gets updated every single day. You can drill down in that dashboard, whichever village you're interested in. Go to the state, the district, the village, and see the names of the heads of the households who have been reported to have received tap connections under JJM. You can actually go there. So the hope is to make sure that there is complete transparency. There's data available for analysis, academic research work, or just someone interested in what's happening in the country, public spirited people. We encourage them all to look at all this so that everyone should know that this information is robust. If it isn't, we would want to take corrective action, but everything is out there. The partnerships with development partners, with academia, with civil society. We've set up the Rural Wash Partners Forum, where development partners are pro bono working with us, working with states, trying to move things forward. So I think speed, scale, efforts at sustainability of schemes, sustainability of sources, pulling together whole of government, whole of society. I think these are some of the unique kind of features around Jal Jeevan Mission. Of course, building on the learnings of the past, on assessments of what worked, what didn't work, and what can we do now to leverage the strengths of this new India.
Absolutely. Ma'am, lastly, I would just like to ask you, so what are the targets next for the coming, targets set for the coming months, and which are the states that are really sort of doing some excellent work? What are the best practices?
So by now we have 8 states and UTs which have already achieved Har Ghar Jal status, which means each of their rural household has been fully covered. We are working with the states and UTs that have still not completed the work. There are 2 in the high 90%. There are another 2 in the high 80%. Basically, when we started looking in some detail at, what were the main points that needed attention, we found that out of 34 states and UTs that we work with, there are 2 UTs which don't have any rural areas, but the remaining 34 states and UTs, there were 13 that accounted for more than 95% of the balance work. Okay. So we focused on those 13. And the good news today is that there's nobody at a really low level. So there is no state in the country today which has less than 30% coverage.
Okay, that's
and again, juxtapose this against the country's average being about 17% on 15th August 2019. So all states have moved ahead, and they moved ahead in a very systematic manner. So starting with identifying the sources for water supply, making the project reports, approvals, tendering and award of works, overseeing implementation. So right now we're at the stage where almost all over the country works are on at a very fast clip. Our attention is now to making sure quality is maintained. We've taken on some water and sanitation experts, senior retired technical people who've been going from state to state, looking at the works in the village to see what's working well, what's going wrong, what needs corrective action. So we are trying to give supportive supervision to the states. We are trying to guide them even as the works go on what they need to be careful about. At the start of every year, we decide on their action plan for the coming year. We did that in March of this year with each state. We sit with them, talk to them. We tell them that, look, you're looking to do maybe 10x the amount of work this year than you've done in the last year. Last year was 3x of what you did the previous year. You will need 10 times the technical manpower, people to do audit, financial, so all of that. So I think there's a lot of even a little bit of micro engagement, but it's not with the intention to supersede the authority of the states. Eventually, the states are responsible for this subject, and they're doing it brilliantly, I think.
Thank you very much. That was Vini Mahajan talking to us about all that it takes to provide every rural household drinking water. Thank you so much, ma'am.